regulate. So now here near me is this is a mother by the name Steady. She was referred from Tororo. She came in from Tororo as a referral. The baby was a premature with a birth weight of 1.5. With a birth weight of 1.5. And now we are managing her, the baby. The first management is basically kangaroo. That is tying the baby on the mother's chest. That's skin to skin. This one helps the baby to get the warmth, make the baby to have many risks of infection. And then another way we are managing them, if the oxygen saturation is low, we also put them on oxygen. And then if the baby is not breastfeeding, in breastfeeding, we put both, calculated as per body weight of the baby, and then we also give them the neonatal fluids. Then the baby is breastfed every 2 hours, and we give fluids as well, until the baby stabilizes, is able to breastfeed well, and no signs of infection. We may not discharge this baby as early as that. We keep the mother still, and as we educate the mother on how to care, the general hygiene of the mother, plus the baby, and the diet, how she's to eat, and then how to breastfeed the baby. When the baby has stabilized, these babies are usually discharged, and then they are reviewed, given an appointment date for review after 2 weeks, until the baby we see that the baby is gaining, there's no infection, she has finished her immunizations, then she's discharged. That's as per the neonates. As per those ones who come with the severe birth asphyxia, that asphyxia is when the baby during birth has not
Just as you've heard from the health talk, they talked about elimination of mother-to-child transmission of HIV. Okay, so that's why we are testing couples as actually a policy that we test them in order to know their status. In case a mother is found to be positive, we start the mother there and then to prevent unborn baby from getting infected. But why we even have to test the couple, because it is the man who's going to give support to the lady in case. And they also need to know their results as a family so that they stay happily. Those are the reasons why we want to test them. So you have to sign. As long as you are above 18, you have to consent. Every service we give priority to those ones who have come as couples, because they always say they are.
See whether it's normal or not. If you detect that there is a problem, maybe the blood pressure is very high or the blood pressure is low, we give them medication to correct it before they go into the lab. And they end up either with a miscarriage.
And then
Anna Rose Petwa, Senior Nursing Officer by profession. I work with Mbale Regional Referral Hospital with Sustain in Mother-Baby Care Point together with antenatal. So here where I am is where we dispense drugs, ARVs, for the mothers who test positive. So just to give you a background, all mothers who come to attend antenatal clinic in our Valley Regional Referral Hospital are supposed to come with their husbands because of male involvement in PMTCT. It used to be PMTCT. We are off PMTCT now. We are now on EMTCT. PMTCT was prevention of mother-to-child transmission of HIV. At least we did our best. The impact was good. That's why now we have said we should eliminate it. That's why now from PMTCT we change to EMTCT. That is elimination of mother-to-child transmission of HIV/AIDS. So all mothers who come to the clinic, as they come in, they are given a health education talk. They are supposed, of course, I told you to come with their partners. They are given a health education talks on several topics, including elimination of mother-to-child transmission of HIV/AIDS. From there, they are given pre-counseling, pre-HIV test counseling. Then they are tested for HIV together with their partners. From there, they go in for post-testing counseling. They are given the results. Now, for the results, of course, the results come two-way, or should I say three-way, okay? Results can come negative, results can come positive, and results can come discordant. Negative, of course, when the lady has no HIV with the husband. Positive, when the lady has turned out positive and probably the husband has also turned out positive. Or discordant, that's when one of them is negative and the other one is positive. After the test, of course, they are given, as I told you, the post-test counseling. After the post-test counseling, we are to enroll the HIV positive mothers in the EMTCT program. On enrollment, of course, we take the blood for CD4 count. That is, we want to see the number of the ascaris that mother who has tested positive has in her body. And we base on that, because when we start the drugs, we want to see how she is responding to the drugs. So for the first time they come in, of course, as I told you, we enroll them. We give them pre-counseling, HIV counseling, post-HIV test counseling, and we enroll them. So on the drugs, depending on which combination. For example, a mother who has come for the first time and she has tested for the first time in the clinic here, we enroll them and we give them what we call a tripler. Okay, it's a combination of 3 drugs. That is option B plus. But however, there are those mothers who had already tested positive from anywhere else and they were started on ARVs. So when they come in here, we continue with the HIV regimen, the drug that she was on before. Now, here the mothers who come in for the first time, as I told you, we put them on option B plus, and this is option B plus. It has 3 drugs in it. That is TDF plus 3TC plus EFV. That is tenofovir, lamivudine, and efavirenz.